Hello, my name is Abigail Hathaway, and this is my final paper presentation, an analysis of healthcare communication protocols, a systemic review of leadership style and associated organizational impact on employee effectiveness and patient experience. There is much misinformation that gets circulated within the healthcare system, which leads to unfavorable patient experience along with iatrogenic errors overall impacting patient safety, ultimately impacting organizational operations. This misinformation is both internal and external and gets circulated intentionally and unintentionally. As a result, leadership styles and communication practices are in need of change management protocols to be implemented in order to enhance systemic efficiency of operations. So how does organizational leadership styles and circulation of intentional misinformation impact internal and external systemic and patient outcomes in healthcare? Understanding the impact of communication processes, leadership styles, and associated working conditions on patient experience is critical for further evolutionary development within the industry. Nearly 50% of adverse events in hospitals are preventable with communication. Research suggests approximately 60 to 80% of patients knowingly lie or hold back information to alter the outcomes to be more in their favor. For healthcare systems to be successful, leadership should know the condition of their flock, therefore the status of the people and their working conditions in order to induce lasting change. Personal experience in the healthcare system has fueled this research proposal, as I've personally received both favorable and unfavorable care. After a misdiagnosis in the ICU, I had a cerebral angiogram that was performed, which induced an iatrogenic outcome of cortical visual impairment, which left my vision hindered from normal functioning for days. This opened my eyes to the realities within the healthcare system, and I felt helpless due to the neurosurgeon and the neurology team ignoring my input on the condition that developed after the procedure, indicating that that doesn't happen. However, I found a study that shows that in a small number of patients that undergo that surgery, it can occur. Overall, this experience has fueled this proposal and this research topic and will act as an additional resource for leadership and healthcare workers to broaden their perspective and communication protocols. Beloved, I pray that all may go well with you and that you may be in good health as it goes well with your soul. Due to the complexity of research and metadata associated with this study, the methodology to be utilized is a mixed methods, action, science, hermeneutic approach. Collection and conclusion of metadata will highlight the importance of organizational change and communication processes for improvement. The EDIC deductive analysis will be informed by the metadata and case studies, and the EMIC inductive analysis will be on the researcher's own subjective epistemological observations and experience. Research is limited to the research bias, limitations of prior researchers, and the extent of the case studies utilized. For groups and dimensions, the collected metadata will be articulated and subjectively awarded ranked on a 5-point Likert scale, with 1 being very dissatisfied and to 5 being very satisfied. The groups for this study will consist of 3. Group 1, favorable patient experience. Group 2, unfavorable patient experience. And Group 3, the researcher's subjective epistemology. With the dimensions, I have the groups listed here. However, there will be subgroups as well. And this concludes my presentation, and here are some resources. Thank you for watching.